The region will lose an entire generation of world-class Soviet-trained epidemiologists. Without enough specialists on the ground, the region's public health systems, since we talk about several countries, will face increasing vulnerability to biological incidents, whether natural, accidental, or deliberate acts of terrorism. The higher education institutions in the region are no longer producing sufficient numbers of qualified professionals. Education systems in general suffer a chronic lack of funding, and many universities have either closed their sanitary epidemiological departments or cut the academic hours devoted to epidemiology. Another challenge I would like to briefly discuss with you is terrorism. Regional terrorist groups such as Caucasus, Emirate, and East Turkestan Islamic Movement are seeking greater influence in Eurasia. They establish international contacts and are believed to have the support of transnational terrorist networks such as Al-Qaeda. Recurrent terrorist acts in Russia and current insurgencies on Afghan-Tajik border indicate that these problems show no lessening. In fact, terrorists have become more lethal, indiscriminate, and more violent. Number one, train more specialists. International partners should cooperate with regional governments to resuscitate education and training in the public health sector to help ensure that new generations of specialists are trained in the whole spectrum of infectious diseases. Faculty improvement programs at local universities and paid internship at designated institutions could attract young scientists, and international and domestic organizations such as National Academies of Sciences, World Health Organization, World Bank, the Biosafety Association for Central Asia and Caucasus. All of them should also pressure the region's governments to increase budget allocations for scientific research institutions responsible for disease monitoring and outbreak containment. And I think international biological threat reduction initiatives should include the former Soviet nations in these discussions and should assist the region's government, regulators, and facility managers with developing better personnel regulations.